Hi all, myself Dr. Ankur. I'm a consultant pulmonologist and director at Langsuk Center for Respiratory Excellence. We run a state-of-art center in the heart of Delhi at Rohini for managing all kinds of respiratory disorders. I'm a consultant pulmonologist for the past more than 9 years now. As far as TB surveillance goes, there are various national and international bodies are there. Like for example, if we see on a global level, there is World Health Organization. In India, it was earlier RNTCP, that is Revised National Tuberculosis Control Program, which has now been converted into NTP, National Tuberculosis Elimination Program. So there are similar bodies at national and international levels which conducts the surveillance. So surveillance basically means collecting data of patients, those who are either newly diagnosed per 1 lakh cases, that would be incidence rates. Then total number of cases, those who are ongoing treatment, that would be the prevalence per 1 lakh population. Similarly, mortality rates are calculated, means how many patients have died because of tuberculosis. So there are various parameters which are used for collecting the data. That would be incidence, prevalence, mortality rate, plus the cases having the comorbidities. For example, like certain population of diabetic population is more prone to develop TB. So that data is also captured. HIV patients, number of patients of HIV developing TB or TB patients having concomitant first time newly diagnosed HIV. So there are various parameters which are being monitored. So this is how the surveillance is carried out by various national and international bodies. Apart from this, there will be further data of not only newly diagnosed, there will be data of treatment completed cases, those who have defaulted on treatment, or those who have relapsed after taking treatment. So there is plenty of data which is being compiled at national and international levels. First of all, we must understand what do you mean by directly observed therapy. So, since the tuberculosis treatment is a long-term treatment, for 6 to 9 months, somebody for a drug-sensitive case has to take treatment. So, very important is that the therapy should be directly observed by somebody. That is why the name direct observation treatment, DOT, directly observed treatment or therapy. S stands for short course. Short course means 6 to 9 months of treatment which we are giving. So the very important thing in DOTS to be understand that it should be monitored or observed by somebody. Earlier, the DOTS treatment was to be observed or monitored only by a DOTS provider. A DOTS provider could either be a doctor or could be a trained paramedical staff. However, since the TB burden was increasing, so family members also were included as DOTS providers. So a patient can take treatment under the supervision of a family member also. That is called as directly observed treatment or directly observed therapy, short course. Now the importance of it in adherence is because once the patient starts improving, supposedly let's imagine that after 1 month a patient starts improving, the cough, fever, or blood in sputum, or weight loss, appetite loss, every symptom starts improving after taking treatment. The very common reason for failure we see is that patient might stop taking treatment falsely believing that I am completely cured. That is why it should be supervised by somebody. That is why it should be under direct observation. Also, it provides psychological support to somebody who has to take treatment for 6 to 9 months long. So psychological support is very important. And when adherence improves, the cure rate improves. When adherence improves, the failures they reduce. The resistance which might be developing in certain cases because of lack of compliance, that will improve. So directly observed treatment is extremely crucial. So herein we will discuss about only the medicines pertaining to drug-sensitive TB, because for drug-resistant TB the list is quite exhaustive. For drug-sensitive cases, predominantly 4 medicines are used, that is rifampicin, isoniazid, ethambutol and pyrazinamide. Rifampicin, one of the very common side effects is developing skin itching, Then another very common side effect is derangement in the liver enzymes, which is hepatotoxicity, and especially the rise in the bilirubin levels. So these are very common side effects. Another common physiological change, it is not usually a side effect, but most of the places you will find mentioned as a side effect, that is orangish, dark yellow discoloration of body fluids, especially the urine. That also happens because of rifampicin. Then isoniazid, apart from causing hepatotoxicity, again, the liver enzymes might be slightly elevated because of isoniazid. But the most important side, it can cause something called as peripheral neuropathy. It usually produces symptoms in the form of tingling, numbness, burning sensation in the limbs because of nerves involvement. This is called as neuropathy. Then ethambutol is usually a safe drug. It does not cause any kind of hepatic derangement, but one of the common side effects which can be seen is the changes in the visual status of the patient, the retrobulbar neuritis which can develop. That is why ethambutol is usually not given in children less than 6 years of age, because they cannot complain, they cannot bring to notice to the doctor the changes in their visual system. What would happen is the changes in the color vision of the patient might start happening. So patient has to report it at an earlier level. That's why it's not given less than 6 years of age. Then the fourth one, pyrazinamide. Pyrazinamide can cause, one of the very common side effects is joint pain. Joint means patient can have debilitating pain because of the rise in the uric acid levels. Then another very important side effect, which is the most common, in fact pyrazinamide is the most common culprit agent for causing hepatotoxicity. The derangement in the liver enzymes is caused by pyrazinamide. So these are the common drug sensitive medicines which are given. Streptomycin or the injectables were earlier included in the regime, but now they are not part of it. So we are not discussing that. But if somebody is receiving injectable streptomycin or any other side effect, is the site at which the injections are given is usually developing soreness, tenderness or ulcerations, reddishness, inflamed, and others could be nephrotoxicity, means damage to the kidney, and ototoxicity, which is the hearing damage which can happen. My message to the TB patients, the foremost important thing for anybody who is watching this, if you or anybody in your family is suffering from tuberculosis, that it is curable. The most important thing which I can convey to you is that it is curable. Whatever you are going through right now is completely manageable. We understand that it is a challenging condition. We have been through it as well. However, it is manageable. Whether it is drug sensitive or it is drug resistant, it is manageable. Any complications, any side effects you are facing, it is manageable. Complete your course of the prescribed duration of treatment, and your chances of cure will be like significantly high. These days, the quality, the potency of medicines which are available is excellent. So please complete your course. And another important message is that whatever symptoms you are experiencing, whatever side effects you are experiencing, please convey them to your healthcare provider, and do not make any changes to your tuberculosis medicine on either partial knowledge or false knowledge, or you have heard it from somebody and you have made it, you make that change yourself, which is not advisable. And since it is curable, it is also your responsibility that it should not spread to somebody else because of you. So please wear a mask, please do not cough or spit in open places, and you will be completely fine.